Alright, so we're doing the Fraxel Dual Restore 1550 and 1927. We are treating Dr. Anderson mildly aggressively with the 1550, which stimulates your collagen and elastin. So my presets for him are going to be 30 millijoules for energy.
Okay.
Treatment level 4, and I'll be doing 4 passes. Turning the cooling up. You want the tension release balls? Okay, we're going to put your goggles on. And we are going to start at the right tempo. You ready? So one pass technically is just up and down, and we'll cover the whole surface of his forehead first, doing up and down motions.
So we're doing around the eye area now?
Just that one pass. We'll go a little bit closer with a smaller tip to go around his eyes.
Okay.
So we just finished the right cheek. Now we're going on to the chin. So I can get a little bit closer to the eye.
Okay. How are you feeling so far, Dr. Anderson?
I'm doing fine.
You doing fine?
Are you still recording?
I sure am.
So you can see this tip is about the quarter of the length of the other one.
Right.
Which means I can get into those smaller crevices right around the nose and certainly right underneath the eyes.
Do you do the same amount of passes as you would with the larger tip?
No, I do half as many because the tissue around the eye area is thinner.
Okay.
It's not able to absorb as much energy, and you're going to be pretty swollen in your eye area anyways. So most people would rather not have that much swelling there. Do you have a preference, Dr. Anderson?
I don't
Degrees.
know.
Must be able to see.
You can go right around the crevice of the nose here. And that's it. He's finished the first half.
What would you say your pain scale was for that first half of the treatment?
Oh, probably 5 out of 10.
5 out of 10? Okay. And he was also numbed with a topical numbing agent, which helps a bit.
Right, and we can call in a non-narcotic pain medication, but Dr. Anderson didn't take any, so that's not bad.
No.
So we're only halfway through?
Exactly. So you finished 1550, which is the wavelength that stimulates collagen and elastin, firms and tightens and tones your skin. And it also decreases the size of your pores. Now we basically do it all over again with the 1927 wavelength, which targets the melanin in your skin. So it gets rid of any hyperpigmentation or discoloration.
Okay.
So starting again by the right temple. And I don't think that this setting is near as painful as the 1550. Do you, Dr. Anderson?
No, I don't.
It's a lot more tolerable.
Yes, it is.
I can already see he's swollen a little bit in the areas that have been treated. Now, how long does that swelling normally last?
So he's immediately going to be swollen from the treatment, and he'll get even more swollen throughout today, and even tomorrow morning he'll probably wake up with more swelling, but that lasts for normally about 3 days. But if you stay elevated, sleep in a recliner, or with some pillows propped up, that can reduce the edema and for how long it will last for you. And if you're really concerned about it, you could take a Benadryl every 6 hours.
Okay.
I don't really think that's necessary, but...
I didn't have much swelling the last time.
You didn't?
No. I don't think I did. I had a little bit the next
Swelling
day, but that
goes
was
away,
about it.
generally you'll start to crust, and that's when you get that kind of coffee grind appearance. And that usually lasts for maybe a day and a half to 2 days. And you're back to your normal self within a week.
So not a lot of downtime.
Not at all.
Actually, on the 4th day, it was actually looking pretty good. That's when we had our Christmas party.
Yeah. I mean, I was back to my normal self after maybe 5 days. Some people take a little bit longer to heal than others. It really varies on the person.
The time?
So your redness will last with your swelling like maybe 2 to 3 days, but honestly you'll have an underlying pink in your skin after this treatment for up to 4 weeks. So we are 100% through treating the forehead.
That's good.
Do you still have that sheet on how to take care of your skin post-Fraxel from last time, Dr. Anderson?
You might want to give me another one.
Okay. So you always want to be very gentle with your skin for the first week to 10 days, then you can get right back on your normal product regimen.
And that's written out for patients?
Every time. What to do AM and PM.
And how long do these treatments normally last while you're in the practice? Are they about an hour, 2 hours?
It depends on what area you're treating. You come in and you numb for about 45 minutes to an hour, and treating just the face, being under the laser would probably be a total of 25 minutes, maybe. It's not long at all. Alright, we're going to do one pass under his eyes. Right at the brow. Perfect. And Dr. Anderson is all done with his face. So now I'm going to go get a cooling mask, and I'm going to let that set with masks for compromised skin. And we've used it on one patient already who said it just decreases that really hot sunburn feeling. So you'll have to let us know how it feels.
Okay.
And Dr. Anderson, what are you doing now? Is this a cooling mist or air that's blowing on you?
It's just cold air.
Okay.
Kind of makes it feel cool, comfortable. Takes away a little bit of the sting.
Perfect. Okay.
In fact, I think I'll take this home with me tonight.
All right, and Jessica's getting the mask ready. This is applied to patients after each Fraxel treatment.
The energy down a little bit because the tissue on your neck is a little bit thinner. It's going to take a little bit longer to heal. So we've decreased our settings. And we are ready to start with the 1550. Are you ready?
Yes, ma'am.
Do you do the same amount of passes on the neck area, or how is that
do.
different? Okay.
Same amount of passes, just turn the energy level down for both wavelengths, 1550 and 1927.
Okay.
And we stop, if you're doing the face and the neck, we always go up to the jaw to make sure it's cohesive with the face, but you don't want to have a line of demarcation at the clavicle or at the bottom of the neck, so we kind of...
And what areas can this be performed on?
You name it. Anywhere, really.
Okay.
Face, neck, and chest are very common. We do arms and hands a lot.
All right.
But really, anywhere that you're worried about fine lines or loss of elasticity, or anywhere you have hyperpigmentation, any UV damage from the sun.
Does it treat stretch marks as well?
It does. So
Okay.
I've treated tummies for post-pregnancy stretch marks. You can treat the breasts. Anywhere your skin has been stretched, it will improve the elasticity of your skin. In 1927 for hyperpigmentation and UV damage, and Dr. Anderson will finally be finished.
Dr. Anderson, for that part on the neck, what would you say your pain was?
Well, it's probably 4 or 5 out of 10.
4 or 5 out of 10. Okay. Very doable.
And once again, he didn't even take any pain pills.
Mm-mm.
So we've adjusted our settings. We've changed it to 1927. This is the last part of the treatment. It's not as painful, but we're near the finish line.